A house fire can begin from a single ember. As it comes in contact with more objects, the fire spreads more and more and becomes bigger and bigger. By the time the flames are visible on the exterior, the inside is already damaged beyond repair. This is much like a patient of Huntington's disease. Once the signs and symptoms of the disorder are recognized, the interior damage has already progressed to such a degree that the degeneration cannot be reversed.
Hi, I'm Cheryl Sullivan-Staveley. I'm a registered nurse, and I am also a Huntington's disease advocate and educator. Although I'm a registered nurse, all of my 25 years worth of experience with Huntington's disease is more personal than professional.
Huntington's disease is an incurable brain disorder that causes progressive degeneration of mental and physical control.
The nerve cells in the brain break down over time and greatly impact both a person's motor and cognitive function.
So could I just ask you if you could describe Huntington's disease in a sentence?
Huntington's disease is a hereditary neurological disease for which there is currently no effective treatment or cure. I really need to say it in 2 sentences.
Oh, that's fine.
It affects people motor-wise, cognitively, and emotionally. It has often been compared to having Parkinson's disease, Alzheimer's, and ALS all rolled into one.
Approximately 30,000 Americans are currently living with Huntington's disease.
Almost 1 in every 10,000 Americans are diagnosed with the disease.
But 250,000 Americans are still at risk for developing it.
While all people are born with the Huntington protein, only those who inherit the expanded version of the gene will eventually develop the disease. In a Huntington disease patient, their DNA sequence contains a 40-plus triple repeat of the CAG code, which is the expansion of the heterozygous gene.
In this pedigree chart, the blue individuals are carriers of the expanded Huntington protein. Because they are carriers of the gene, they will eventually begin to display symptoms of Huntington's and can potentially pass the gene on to their offspring. This curve represents what percentage of people who carry the positive Huntington's allele are displaying symptoms at what age. In juvenile cases who are under the age of 21, less than 10% of patients are already displaying any symptoms. This is because most victims do not display any symptoms until at least age 30. By age 40, at least 50% of all the patients were displaying some visible symptoms, and by age 80, 100% of the patients were all displaying symptoms.
The juvenile form is very rare. Only 30 to 35,000 Americans have HD, and only 10% of that of those people have the juvenile form.
This histogram displays the frequency of ages of diagnosis in Huntington's disease patients out of a study of 750 people. From this model, it is clear that a majority of patients are diagnosed around age 40. You can also tell, based on this study, how rare juvenile cases of Huntington's disease are.
What are the signs and symptoms to Huntington's disease?
There are 3 components of Huntington's disease: the motor symptoms, the cognitive symptoms, and the psychological or emotional symptoms. So with the motor symptoms, the predominant sign or symptom is chorea, and that's involuntary movements of the arms and the legs. People just have flailing movements or moving about all the time. Also, their gait is off, their balance is off, so very often they look like they're drunk. The motor symptoms also affect speech and swallowing. The disease lasts approximately 10 to 30 years, so slowly over time it's very difficult to swallow, and your speech becomes very slurred as well. Cognitively, it's very difficult to learn new ideas, any kind of new theories. what you know, whatever is deeply ingrained in your brain, you will continue to know, although with your speech difficulties, it would be hard for someone to actually know how much you know or don't know. Other cognitive impairments are impulsivity, outbursts, and forgetfulness. Someone with HD doesn't generally forget people, their family or their friends, like an Alzheimer's, but they will, forget conversations, forget facts that you just told them, or they'll just keep asking the same questions over and over again. And
Nervous system.
This diagram shows the brain's basal ganglia, which is the most affected structure in Huntington's disease. As you can see in the bottom picture, the basal ganglia is larger in the HD patient, signifying the neurological deterioration.
Musculoskeletal system.
For the musculoskeletal system, neurotransmitters from the central nervous system are stimulated by muscle contractions, which results in energy in the form of ATP. What happens in Huntington's disease patients is the deterioration of the basal ganglia and hypothalamus causes a loss of functional neurons. In the early stages, the individual will experience lack of coordination and chorea. As the stages progress, the individual will have total loss of function due to the atrophy of their muscles. At this point, most individuals are bedridden.
Digestive system.
The digestive system is an involuntary process in healthy individuals. In Huntington's disease patients, it is common for failed swallowing to occur because the bolus enters the trachea, which leads to choking. This is caused by muscle atrophy, as the muscle contractions become weak. As the disease progresses, it is common for the individual to lose weight due to these eating difficulties. Therefore, over time, the patient will gradually move to softer diets.
Urinary system.
A healthy urinary system can be voluntarily controlled by an individual. Due to the weakening of muscles in Huntington's disease patients, an unfortunate symptom is fecal and urine incontinence or lack of control. This can often lead to incomplete emptying or involuntarily emptying of the bladder or the rectum. During leaking, excretion, or defecation, the bacteria is released and often results in irritations or, more often than not, urinary tract infections.
Cardiovascular system.
Action potential is generated at the SA node and spreads to the AV node through gap junctions. There, it is delayed before passing to the AV bundle, which is located in the interventricular septum. Action potential is conducted in the AV bundle along the left and right branches to the Purkinje fibers. Here, it is spread via gap junctions throughout the ventricles through cardiac muscle. In a patient with Huntington's disease, due to their weakened heart over time, it is often common for arrhythmias to occur. This diagram is a PQRST wave, which represents the contraction of the heart. In a Huntington disease patient, due to their weakened heart, it causes the equivalent of an individual running a marathon on a daily basis. Therefore, this causes decreased contraction rate and strength.
Respiratory system.
In a Huntington's disease patient, a common cause of death is pneumonia. Pneumonia is a buildup of fluid, bacteria, and blood cells in the alveoli of the lungs. The most common type of pneumonia for these individuals is aspiration pneumonia, which is the result of food entering the lungs due to choking.
Reproductive system.
Reproduction is the biological process by which new offspring are produced. The greatest risk in a person with Huntington's disease is the 50-50% chance of passing the disease onto their offspring. Due to recent research, if an individual at risk wants to find out whether or not they have the mutated gene, they can do so at age 18. Also, if parents want to test their offspring either early on in their life or before it starts, there are two options. The first being PGID, or pre-implantation genetic diagnosis, which is the procedure of doctors fertilizing the sperm and egg
and performing an HD test on the embryo once it reaches to approximately 8 cells. From there, if the embryo tests positive for the HD gene, it can be discarded. If the embryo tests negative, then in vitro fertilization, where the embryo is manually planted in the woman's uterus, is performed. Another possible test is CVS testing, or chronic villi sampling, where they take a portion of the mother's placenta, containing both the child and mother's DNA, and then a sample from the father. Then these DNA samples are combined and tested for the presence of the positive HD gene in the offspring.
How did and does your situation still impact you mentally?
Well, clearly, taking care of somebody that has a terminal illness is, a very difficult burden, a heavy burden. That's what I want to say, both mentally and physically. And so, over the past 25 years, I have had experience, bouts of anxiety and depression, and but fortunately I knew enough, to seek counseling myself. So I see a psychologist, every week. And in the past, I have also been on medication for both depression and anxiety. It's also really important, to surround yourself with the best support system that you can. And I've been very fortunate to have a really good support system with my family and friends. So they've come, to help me, sometimes to give me a break while I could just go out and do an errand or whatever while they would stay with Joan or Megan, or just, to have them be present to vent is very helpful. Also, I run 2 support groups. One is just for caregivers only, because it's really important for the caregiver to be able to, speak freely without their loved one who has HD. And so just being able to be with other caregivers and hear how have they dealt with specific, issues, and just a general HD support group, and that would be for anyone in any way affected with or by. For me personally, and for the people that attend my support group, that's just another great, support system.
Huntington's disease is often just as difficult to deal with for loved ones who take care of the patient.
It poses both physical and mental challenges.
It's common for caretakers to experience anxiety and depression.
This is where it is crucial to find help.
Coping and accepting the reality of the disease is the number one step.
This disease could legitimately be stopped if there was just more awareness and if people were responsible. So advocating is what will get us to cut off this monster.
Help Huntington!